my world hasn't changed. It's like the rest of the world has caught up to my world in terms of the problems with opioids and the need for treatment and the need for reduction of dose and alternative treatments for chronic pain. That's the world I've lived in for the past decade. Now, since the CDC recommendations and legislations in cities and lawsuits against opiate manufacturers, the truth about opioid use and potential problems with it has become more readily accessible. I think it's about time. I mean, I have great concerns for people, the opioid orphans, if you will, people who've been on high-dose opioids who are left without any resource when the doctor says, oh, no, I can't prescribe anymore. I think that's a bad problem. And we see people come into my treatment center because they can't get their opioids and they have pain. So they can come into our place, get detox safely, and then find alternative ways to deal with pain. But most patients don't have access to that. Most patients are left high and dry with no treatment plan and no source of any medication, so they go into withdrawal sometimes. And though you don't usually die from opiate withdrawal, it's a very, very unpleasant, unhealthy practice, in my opinion. So I think the pendulum has clearly swung. I think we take opioids much more seriously than we did before, and I think that's a good thing. I don't think we ought to be giving them out the way we used to. That said, now we have to deal with the fact that, billions of people are on opioids in our country. And what are we going to do for those people? Are we going to continue them? Are we going to cut them off? If we're going to cut them off, we need to have a civilized, compassionate way of doing that. And right now we don't have that. It's so black and white. The approach to opiates is just black and white. So people are overdosing. The promotions were unethical and inaccurate, and we just have to, stop everybody from taking opioids. Well, that's foolish. I think we ought to be extraordinarily judicious before we put somebody on opioids, certainly for any amount of time. We know that after 10 days, people will become dependent 20% of the time if they stay on opioids. So we have to take that message very seriously. And then we have to have a plan, some kind of plan, for the people who are already on high-dose opioids. And I don't think that we have that. I don't think clinicians are well trained in helping people come off their opioid. I think we were really expert at the dosage and the rotation of the opioid interactions of different opioids, but I don't think our generalist population, who are pretty much stuck with patients who are on opioids, are adept at doing what needs to be done, which is facilitating people coming off the opioids and moving on to an alternative treatment for pain. I think, the addiction moniker is really tricky. A lot of the patients are involved with chronic opioid use certainly don't identify as having addiction. A lot of patients who come to my center don't identify as having addiction. They just went to the doctor, they took what was prescribed, they're physically dependent, and they've got this, I call it complex dependence. Jane Ballantyne quoted that term. So it's the relationship between me and the drug is better than the relationship between me and the doctor, the prescriber. That drug means something to me. But it's not about getting high, it's about getting relief. So my need for relief has been equated to that drug, and what we really want to help people see is that relief comes in different forms, and when you remove the opioid from the picture, oftentimes the pain level comes down chronically. It's hard to sell that to a patient. I don't know that the physician population feels as comfortable conveying that message, but I think that's the message that would really serve our patients in the long run.